Hi, my name is Marcelo Michelson, and I'm here to present to you Juntos, an initiative to help us tackle together the new coronavirus epidemic. We have the simple non-disclosure agreement, and these are my contacts. You can reach me by email or WhatsApp and phone number. So, Juntos, which in Portuguese means together, is basically a smartphone app, but it's a distributed system of self-monitoring for people at risk of contamination from SARS-CoV-2 with or without showing symptoms. It will help people to take care of themselves and have less risky behavior, leading to less hospitalizations. We know that people are isolating, but not everybody is isolating the same way as others. And we believe that this app can help people understand the importance of doing that. It will help communities to self-organize and collaborate, and governments to manage the isolation phases and the opening for circulation of the population with more precision and knowing when to do it and how to do it. It will help organizations who want to define protocols to minimize the spread of the virus through its operations, and it will impact their employees, customers, and suppliers. And healthcare providers can decrease the number of hospitalizations through more precise actions towards its clients. Our hypothesis is, if the same number of people needed for vertical immunization decide to use our app, we could reap the economic benefit of opening up the country responsibly without the hundred thousands of deaths. Why are we doing this? We're doing this because we want to live in a world where people take responsibility for their actions in order to benefit society. We want to do this because we want the least amount of people dying or being placed in ICUs without need. We are also doing this because we believe that the government doesn't need to have absolute control over our whereabouts through smartphones and surveillance cameras. We can actively do this. We also want to do this because we want social contact to be reestablished as soon as possible, but in a responsible manner. And we would like to see our economy restructured in order to serve people and planet and not the other way around. We gather a high-level team here in Brazil, one of the best software houses in our country called Seasoned, and I would say the best user experience company called Handmade. We are partnering with Semente Negócios to manage the whole project. We are leading this project, we are Syntropy, and we are partnering with the best universities and institutions in Brazil, like Unicamp, USP, ITA, and Fiocruz. They will manage the artificial intelligence and machine learning piece of our app. This group of partners is already doing business with clients such as Volkswagen, Petrobras, just to name a few. We are basing our app and our assumptions and the Imperial College study that shows that what we need to do basically is to keep the number of people needing ICU units to the minimum, or to the level that our health system can support. And the gray areas is where the social distancing and isolation happens, and the white areas is where you free people to move around. Our app wants to help to do this in a better way so we can shorten the gray areas and make the white areas larger so more people can walk, but responsibly, without crossing that threshold of ICU beds needed. The latest studies are showing that 5 to 12% of people tested positive need an ICU. Here in Brazil, it costs 100,000 reais, which nowadays is like $20,000 for a person to to use an ICU in the private sector. If we avoid 25 of those, we can pay for the development of this project. So here's our model. We understand that patient 1, the one in the middle, is already with the virus on day 1, and he will become more symptomatic around day 5, day 6, and that's when around day 4, day 5, he starts to transmit to other people. He will transmit first to the one that lives with him, and then on day 7 he will transmit to the orange one on the upside part of the graph and to the pink one on the bottom. And he is notifying our app, and he asks the other people around him to download the app and notify as well. So patient number 2 will be infected on his day 1 or on patient 1's day 7. When it reaches day 3, he will get a notification saying you have a high chance of being infected, even though you're not showing symptoms. But through our analysis, you had contact with people which are showing symptoms nowadays. So isolate properly. Maybe isolate from the people who live with you so you don't spread to them. This is the 2 patients in parallel. It's very simple to use. It's a free downloadable social media-like app. The user answers questions and posts information about meetings, places, and symptoms. The user can invite their contacts to the network, spreading the usage of the app. User can allow or forbid the app to use its GPS info, so it's up to the user how much data they give. An artificial intelligence system will match this data with epidemiological data, and users will get notifications about their risk of having the virus, and they also will be able to look at places and behaviors that are more risky than others. We're going to start collecting general data like age, city, where they work, diseases that they have, who they met, supermarkets, pharmacies, etc., time of contact, degree of contact, and symptoms related to COVID-19. So organizations can then ask us to install a dashboard so they can have aggregated data about their employees or about their clients. We are not going to provide individual data. We are strong believers in the privacy, and we believe that we can have the best of both worlds. We can have privacy and a good data management, so organizations can create protocols and understand what's going on with their general population. Of course, we can break down that by region, by age, and by other groups, as long as it doesn't give the organization private data about one individual. This will help especially public, like government, so you can track which regions are able to start leaving isolation or start having less social distancing or more social distance as a whole. The app will be free to install, but the companies will pay for it, and it will depend on the number of users that they want to track. The company that decides to finance the system development will get back 100% of its investment and will only pay for the cost of infrastructure and data. We finished the concept of the project on March 26th. We got together with the whole group of developers on March 29th, and we are waiting budget approval. So if you want to invest in this project, or you know someone who wants to invest in this project, let us know. We are going to be able to deliver the first functional version of the app in 3 weeks, and since day 1, the artificial intelligence intelligence people will start working with us, but in order to model it in the best way possible and predict who is more likely to be infected and which regions and which places, we need to train the computers, and it takes from 3 to 6 months to do that. These are the costs in reals, so it's around, nowadays it would be around $500,000 to support our project. Again, these are the partners. I'm happy to answer your questions. Please do contact me. I'm going to leave my contact information again on the screen, and hope to talk to you soon.